atropine, very brief. It's going to be explaining atropine in quite detail with a mnemonic. So main thing about atropine, if one thing you can take from my lecture, it is it dilates your pupils. I want to be sending out some rules which is going to be of the autonomic nervous system. So the first thing is going to be that there can be sympathetic nervous system, and this from the adrenal medulla, and sympathetic innervation of the adrenal medulla sympathetic nervous system, and there can also be parasympathetic nervous system. So every system has a preganglionic site. So preganglionic is going to be releasing acetylcholine. Acetylcholine can always go bind to nicotine receptors, and then there can be epinephrine, which then goes from the postganglionic, it binds to adrenergic. Norepinephrine then from the sympathetic goes to adrenergic, and also acetylcholine goes to your muscarinic. So what does atropine do? It blocks the parasympathetic. So basically atropine is a sympathetic drug because it blocks parasympathetic, it becomes sympathetic. However, what if I told you there is an exception? The exception is that it can that the sweat glands and the salivary glands are innervated by the sympathetic nervous system. However, I want to be really but there can be anti-muscarinic working on them. So atropine can only block the sympathetic nervous system in the scenario of sweat glands and salivary glands. So that's one exception. I want to be talking to you guys some basic names, some different names for atropine. You may hear different names in textbooks about atropine. So one is going to be a cholinergic blocker. That's because you're seeing acetylcholine, it binds to a muscarinic receptor, but atropine blocks it. It can also be called as anticholinergic receptor, again same reason, and also can be called a parasympatholytic drug, is because it's blocking muscarinic, or in other words, it's blocking parasympathetic nervous system. So that's why parasympatholytic. Where do you get atropine from? Atropine, you get this from belladonna alkaloid. Belladonna is basically a plant. I got this image from here, Wikipedia, copyrights to them, and Google Images, whoever. Yeah, this is from a plant. It's known as belladonna alkaloid. It is a tertiary amine. Basically, it has 3 hydrogen ions. No. I think tertiary amine means that there is going to be a carbon, and this carbon is going to be surrounded by 3 nitrogen ions. It has a very short life, except for the eye. So that's why I kind of emphasize the eye. It prevents acetylcholine from dying. So first of all, what is going to be the effect of eye? Basically, with atropine causes dilations and mydriasis, and this is because what happens is your sympathetic nervous system is responsible for dilation, and parasympathetic is for constriction. So normal parasympathetic, you are getting constriction, but with the atropine, we're getting dilation. For the GIT system, we're going to be getting, again, sympathetic system. So sympathetic nervous system always relaxes the GIT. So you can imagine with normal sympathetic nervous system, it's quite not relaxed, tense. Over here is relaxed. Urinary system over here, sympathetic nervous system the urine goes into bladder for sympathetic nervous system, and urine is going to be secreted by parasympathetic nervous system. So parasympathetic system, you can imagine a lot of urine. But then for atropine, there's going to be obviously less urine because, again, it's sympathetic nervous system. The cardiovascular effects are quite complicated. There's going to be high atropine and also low atropine. So low atropine causes bradycardia. It binds to alpha-2 receptors. Alpha-2 receptors, then it allows the acetylcholine to go bind to the muscarinic receptors present in the heart, because alpha-2 is an inhibitory, so it allows a lot of acetylcholine to bind to the heart. But what happens with this high amount of atropine, what it does is that it binds to the SA node, and when it binds to the SA node, it basically is going to be blocking the vagus innervation. Vagus kind of slows the heart. So if no vagus, that means vagus causes decreased heart rate, but less vagus means increased heart rate. So basically, high atropine leads to less vagus, leads to increased amount of heart rate. Secretion is going to be with normal parasympathetic system, you always are resting and digesting with parasympathetic system, so you're secreting a lot of sweat. But with the atropine, you're going to be secreting less sweat. What is going to be the different types of atropine? Basically, this is a quick overview. The atropine can cause, like I said, sympathetic nervous system in your eyes, so dilation or cyclopegia. It is not going to be contraindicated in narrow angle glaucoma. Narrow angle glaucoma is basically your glaucoma or your aqueous humor is going to be produced by ciliary body. It then goes over here, and then it gets reabsorbed by the trabecular meshwork. However, in narrow angle glaucoma, it blocks this, and then it leads to increased amount of ocular pressure. So do not use atropine over there. Why do not use atropine? Because it can stretch the lens and maybe cause increased amount of pressure. There can be GIT symptoms. Basically, GIT causes increased amount of motility is going to be reduced, and also the acid is also going to be reduced. So it is not really good for peptic ulcer disease. But if you have some sort of patient who is maybe having diarrhea, if you're having some patient Yeah, possibly diarrhea, the GIT motility can be reduced, but your acid over here is not going to be reduced. So better to use this perazepine, which is M1 antagonist, which decreases gastric acid. Also, urinary is going to be used there. So if you're going to have a patient with a lot of urinesis, what happens is atropine causes sympathetic nervous system. With sympathetic nervous system means decreased amount of urine, because in sympathetic nervous system you're getting much more rest and you're getting much more not rest and digest. You're getting much more flight and fright response. You're going to be having cardiovascular. I explained in detail. High temperature. Why are you getting high temperature? Because you're having less secretion. Why is less secretion? Because less secretion. What is less secretion? Means your cooling mechanism is going to be less. So therefore, it's going to lead to a high amount of temperature. So when can we use this therapeutically? Basically, if you want to cause dilation. But the thing is, atropine has a long half-life or life. I believe atropine can last for 7 to 14 days in the eyes, only in the eyes. Please don't forget, this is only in the eyes. And and it can lead to mydriasis, cycloplegia. Which cycloplegia basically means that your inability to focus on near objects. And you should, if you want to dilate the pupils, for some reason use phenylephrine. Phenylephrine, what is it? It binds to your adrenergic receptors. Adrenergic receptors is basically sympathomimetic, and sympathomimetic means increased amount of dilation. Antispasmogenic, it can cause less amount of spasms in your GIT. So you can use it for anti-secretory. Secretory means in your upper and lower amount of respiratory tracts. And it can also be an antidote to cholinergic agonist. What does this mean? Cholinergic agonist. What does this mean? Basically, it means it basically means that the cholinergic esterase inhibitors increase your cholinergic, leads to increased acetylcholine, which leads to increased amount of parasympathetic nervous system. So atropine is going to be sympathetic nervous system. So to reverse that, you give atropine. So if you have any patient with too much parasympathetic nervous system, always give atropine, because atropine inhibits parasympathetic nervous system. Pharmacokinetics is very, very simple. You have a liver, metabolized in the liver, it's excreted in your kidney, and its half-life is about 4 hours. So that was quite easy. Adverse effects here with our mnemonic comes in place. Take atropine, but it sucks. So take means tachycardia. Why? Sympathetic nervous system. When your sympathetic nervous system is there, increased amount of heart rate, especially at high doses. The but over here, the B over here is going to be standing for blurred eyes. The S over here is going to be sandy eyes, or it's going to be sweat glands are going to be decreased. Your sweating is going to be decreased. Your C over here is going to be CNS restlessness, confusion, or constipation. A summary, I want to give you guys a quick summary. Basically atropine. Whenever you think about atropine, think about sympathetic nervous system. So if you have low dose atropine, you're gonna have bradycardia. Why? Because you're gonna be block alpha 2, leads to increase acetylcholine. More acetylcholine means decreased heart rate. Why at high dose atropine means tachycardia, because you're gonna be a block SA node acetylcholine. Less acetylcholine means tachycardia. So that's the reason. Eyes, what's going to be happening in the eyes basically sympathetic nervous system. So you're doing sympathetic nervous system, we get dilation. And sweating is going to be there. Sweating is going to be decreased amount of sweating. Why? Because sympathetic nervous system, basically atropine. GIT, increase amount of motility, decrease amount of spasms. Urinary. Okay, here's my question to you guys. I have a question to you guys. I'm going to be giving you guys a question to see if you guys are paying attention or not. Question: what is the effect of atropine? What is the effect of atropine on urinary bladder? Please answer for me. And the answer is less urine. Why? Because you're in atropine, you're activating sympathetic nervous system, so hence you are decreasing urine production. So that was my question for you, and also answers the last thing, that decreased urine. Credits, major credits to Lippincotts book was my go-to source, and I use 4th edition over here. If I missed out on any credits or also memes, I used loads of memes here. Hope this guys video helped. Any questions, please let me know in the comment section down below. I'm leaving some questions. I might leave a question down below, so stay tuned for that to test your knowledge. Thank you for watching this, and please, I hope to see you guys next time.